Hello from Dartmouth-Hitchcock. I'm Ed Marins, the Chief Clinical Officer here at Dartmouth-Hitchcock, and wanted to give you an update on where we are, respond to some of your questions, and just give some more information about where we are as we face the COVID-19 pandemic across the United States and in our region. So we've got a number of topics I want to be able to hit today. One is testing. We made a decision well over a week ago that we would be testing hospitalized patients and those requiring inpatient care as well as healthcare workers. This was a decision we made based on two things. One, the shortage of some of the supplies, including the testing media and the swabs, but also these were the areas that we thought were most important that impacted the people involved in patients' care and also those that were in the hospital. The recommendations now are echoed by the State Department of Health and actually across the country. Patients with mild disease we expect to isolate at home and improve and get better. If at any time someone is sick at home and needs care, we are here and we are prepared to take care of anyone who has more complicated disease or needs a more thorough evaluation. The testing that we have done here has ramped up. We've moved over to a different analyzer, and we are now testing several times throughout the day to provide results for both inpatients and healthcare workers across the region. This decision really allows us to make the best use of the resources and impact care as best as possible. I want to talk about masks. I realize you're not only getting your information from us and our website, but from a lot of other resources and watching what's happening around the country as other health systems face this crisis. Masks are a big part of the protective personal equipment, or PPE, that we talk about and have been in short supply. And these range everything from surgical masks, level 2 masks that loop over your ears, and as well as N95 or tested masks that more formally fit the face, and respirators. These are all in short supply. There still are no national guidelines for wearing surgical masks for all employees. We realize that other organizations have made the decision to do this. We lack the supplies to be able to do it, and it is still not a recommendation from the Centers for Disease Control. That said, there are evolving guidelines around healthcare workers and probably some patients that need protection, and we are working on formalizing these guidelines. As is the case around the country, we will have to develop ways that we can preserve these resources as best we can, as all across the United States and really the world, people are seeking to source these materials from very limited supplies. I want to thank everyone who has also been involved in a lot of sewing at home and creating these other masks made out of fabric. And these will be helpful in a lot of ways. We may use this coverings over existing masks to preserve the integrity of the surgical masks. We may use these for other patients at risk. These are certainly not going to be used in the operating room or a procedural suite, but they add to the protective care that we want to provide, and certainly are an example of the outpouring of hope and support from our community. I want to talk a little bit about screening. We, like other organizations, are increasingly going to reduce the number of entrances to our organization and have screening both for symptoms and for temperature at our entryways 24/7. This allows us to more accurately understand both the patients, visitors, and staff coming into our organization and their symptoms, and identify people that may need more follow-up care. Finally, in terms of long-term planning, we continue to evaluate what cases are elective, and there are some elective cases that really need to be done in a shorter time frame, and we've redoubled our effort to look at that. That could be the same for other procedures and imaging. The other thing that you should remember is that we are taking this day by day, and we're working with partners across the region, our member hospitals, and the state. We realize this is an unsettled time, and we are committed to coming back and being open and honest about what we're trying to do and responding to your questions. You can always get a hold of us at 603-650-1818 or at dh.org. So that's the update for today. We look forward to coming back with more.